Hello, audience. Do you know I almost never became a nurse? Yes, I almost never became a nurse. I was failed in nursing school. In my third year, my first entry level nursing as a student, 3 weeks, 3 weeks to graduation. My clinical instructor failed me, failed me, failed me. I've been in therapy and I'm done. I'm good. Now I can laugh over this story. She failed me because she felt I wasn't ready to graduate as a nurse. For what reason? I have no idea. I went to nursing school. When I first came to this country, I was a home health aide. And um, I decided if I'm going to be doing this as a career, I must as well go back and get an actual license. So I started nursing school. And boy, I'll tell you, it was not easy at all. It was not easy. If you're a nursing student or you've been through nursing training before, nursing education, you know exactly what I'm talking about. I was always catching up. You can never learn enough. There's too much to learn within a short period of time as a student to make it. And at that time, we were lucky. The information was so much, there wasn't any computer to do any research. So if you need to do any research, you have to go to the library, find a book, and actually read it. There wasn't anything like a computer to click and scroll and get all your information. There wasn't anything like GPT to give you ideas. It was all by yourself. So the the passing grade was a little bit lower because it took a lot of effort and work to get research papers done, to study for your test and all that. I went to clinicals. We went through this program first semester, second was fourth semester classes after you complete um, your college level courses. You have 4 semesters to complete your nursing courses as an associate degree entry level nurse. I went through all that. I passed nursing one, nursing two, which is the med surg, and which happened to be one of the most difficult courses. And a lot of my friends did fail that class and had to repeat it. I barely made it, and most of us barely made it, but I did not have to repeat it. I moved on to the third semester, went through OB, pediatrics, was okay. Every step in every area, you experience some issues, but I went through it with flying colors. And I got to my fourth nursing course, which was the last class. I had made a mistake in one of my skill assessment. We call it skill assessment. So the the instructor will set up, say if you have to insert a Foley catheter, they will set it up. They will put it out there, and you will have to demonstrate the skill to the nursing instructor to show that you are competent to uh, perform that role or that skill. Of my skill assessment demonstration, I had made a little error, and I don't know whether the nursing instructor decided to kind of keep an eye on me. And that was about 3 weeks to our graduation. We had all been given our green letters. At that time, we used to be given a green letter. If you get a green letter, you are good to graduate. So the next 3 weeks was just finalizing all the necessary paperwork and all the tests. We had I think our last but one clinical. One of my patients was on this medication. It's called Augmentin. It's an antibiotic. And part of our clinicals is to study medications that your patient is on. And during clinicals, your nursing instructor can pull you aside and question you on any part of the patient care, including medication. So you need to be prepared. You don't know what he or she will be asking you. So this nursing instructor, out of the blue, of course, I was expecting it, pulled me aside and decided to question me about my patient. And I noticed that her questions was the time frame for my questions was a little bit prolonged. Most of the nurses will go in and they'll come back. What did she ask you? Oh, she asked me a few things, and that's it. Just like they were with her for about maybe 2, 3 minutes or 5 minutes. Mine took longer because I think she was looking to fail me. That's what it is. She was looking to find some error with me to give her a reason to fail me. And hold and behold, she did find one. She asked me to give her the list of medication my patient was on. And I kind of ratcheted it out, or just gave her the information. And then she decided to question me about each of the patient's medication, about the side effects, this. And of course, I don't have a computerized brain to memorize every single patient. The patient was on a lot of medication. The nursing instructor asked me, what is your patient on? What antibiotic is your patient? I said, Augmentin. What is the indication? Indication means what is it used for? I told her. What is the contraindication? I mentioned it. And she realized she wasn't getting any wrong answer from me. 3 side effects of Augmentin that the patient could experience. And I was like standing there. It's like a deer in the headlight with a headlight in their face, just standing there. I was frozen. My mind was frozen. I couldn't answer. All she said was, put your papers here and pack your bags and go back to the classroom. I'll come back there and see you. For no other reason. I'm like, she sent me back to the nursing office, back to the nursing school, and she said to go and see the dean. And I think she had made a phone call to the dean. Of course, they knew what they were doing. I didn't know what it was. So I went to see the dean. The dean sat me down. She said, your nursing instructor thinks that you are not ready to graduate in 3 weeks. So we are going to fail you for these clinicals. And if you fail clinicals, you have actually failed the whole course. So you have to repeat it. 3 weeks to graduation. I have gotten all my graduation uniform, my cap. We used to wear all white gown, and a nursing hat. We used to wear a hat to graduate back in the 90s. My hat, my white shoe, my stocking, my outfit, everything was set. 3 weeks, I'm just finishing up with 2 clinicals and I'm done. This nursing instructor decided that I don't know the side effects, all the side effects of Augmentin. So I am failed for the class. I'm glad I can talk about this episode now because it really affected me. Can you imagine being ready to graduate from nursing school? I have sent out my invitations. We have all the parties planned, and boom, you are no more graduating because you don't know what Augmentin and what side effects. It took a while to recover. By the grace of God, I was able to recover from that experience. To avoid that nursing instructor, I decided for the following semester to go to the weekend classes, the weekend nursing school. And there were just a group of us. Nobody wanted to go to school on weekends, just a few of us. And I had a ball. It was the best experience ever. I studied, I knew all the information from the previous semester. I was able to apply it and just zoom through it just with flying colors with no issues. And I was able to follow a semester after my classmates. So in life, there is a reason for everything. I don't know what would have happened if I had moved ahead to graduate, but for some strange reason, for a flimsy excuse, that particular instructor decided to pull me back because I don't know Augmentin. And I went back and learned all about the medication and was able to graduate successfully. So that is my little experience about uh, not almost not becoming a nurse, because I almost gave up. I almost gave up, but I am here, graduated, practiced for this many years, and I've been fortunate to be doing something that I truly love and to tell my story to the world. And thank you for listening. Subscribe for more stories. Thank you.